Welcome to the Long Story Longer podcast.
I'm Dominic Marano. I prescribe meds.
And I'm KatieBrzyzowski, and I provide psychotherapy.
Long Story Longer is a podcast about mental health and navigating medication, therapy, and whatever else we want to talk about.
We will discuss topics from each of our perspectives. We will try to keep it to 15 minutes.
But it will probably be longer. Hello and welcome to the Long Story Longer podcast. My name is Dominic Marano. I am a family and psychiatric mental health nurse practitioner. I own my own psychiatric practice and I have a doctorate in the nursing practice. I've been in healthcare for over 20 years and more recently into mental health.
Hey, I'm KatieBrzyzowski and I'm a licensed clinical social worker and I have a doctorate in clinical social work and I own a private practice and I've been in the mental health profession for over 25 years.
Welcome back, everyone who listens to the podcast, and hello to our new listeners. Today, we're going to talk about how you receive your mental health care, whether therapy or medication, and which format you choose matters. So there are a couple of formats, and we are going to do... Katie, introduce yourself. I feel like I'm going to talk into too much to start.
That's okay. Well, I'm Katie, and that's Dom. I don't know if you introduced yourself either, but...
Yep.
You're Dom?
Yep.
Okay, good. So now we have that out of the way, we are talking today about telehealth versus in-person therapy. Also, we will touch on text therapy, which some of you may be doing. Wait, was that right? Did I go wrong? Okay.
Perfect. So before we begin, let's talk about numbers. So for pre-COVID, there were only 2 to 5% of mental health sessions done via telehealth. It actually wasn't very easy to get reimbursement for it. A lot of places didn't do it. But by May of 2020, about 85% of psychiatric and therapy appointments shifted online.
And when I was practicing at that time, I started private practice in 2012, and people were starting to use telehealth more towards the end of that, like towards closer to 2020. Before COVID, people were starting to, but you're right, it wasn't reimbursed, it just wasn't as prevalent, and I was too old school to even want to do it. I had not done it at all. I did only in person, and then I was forced to go completely telehealth for at least a little bit, and then some people started coming back in the office, but some people just stayed telehealth. And now I would say, probably less than half of my caseload is tele, but a lot of people still do use telehealth.
Yeah. So in terms of telehealth, it's basically a mainstream option now. Around 40% of mental health and substance use visits in 2021 were via telehealth, compared with virtually none before. And I worked at a substance use mental health place where it was all telehealth. And in fact, at the location, so I worked remotely, and if they had someone who had to come in person, they would set them up with telehealth in the clinic. So it's pretty interesting. Yeah,
really?
Yeah.
Like they weren't gonna see that.
Yeah, they worked out of, and it was neat because it was in a rural area. So like otherwise, I would have had to have driven an hour and a half. But they would do the telehealth appointments there in person. But still,
it's a good idea.
Yeah, most of them they were phone calls actually that I did, and very few were video. And then that was before I shifted to my own practice, which now most are video conference, just because a lot of the insurance requirements require that.
Yeah, insurance. My understanding is that. They used to not pay for just a phone call. You had to be face to face. So and if it was video, fine, but just telephone, Medicare didn't pay for that. I actually not sure if they do now.
I don't think they do. I think it has to be. I think it has to be synchronous video and voice, if I'm not mistaken. Or it's like some insurances may take it, but I actually think it's reduced because you can't see the people. You can't do a full on visual assessment of them. So I'm not exactly sure. And in terms of private pay, I think they can just charge whatever they want.
Any format, any type, whatever you want to do.
Yeah. Even with the advent of telehealth, the surge didn't bring in tons of new patients. Only a small bump from 5 to 6%, and people using these appointments for healthcare. But most importantly was that it helped maintain care during the pandemic, so people were able to get their meds filled, continue therapy. But people had a lot of complaints about it. So I'm not quite sure in terms of outcomes. Katie, what do you think about that?
Well, the one thing that people often want to know is does it work? Does it work to see a therapist online? Is that the same as seeing someone in person? And I would say yes, and research does back that up, that there really isn't there's a meta-analysis of randomized trials. They found that there's no significant difference, statistically significant difference in, the therapeutic alliance, in the satisfaction, the client satisfaction, in the person's severity of certain symptoms. There's no difference between in-person and video therapy. I would also, though, caution people to, a lot of these studies were done just like any research. You have to, who funded the study? Not that they're necessarily going to skew the results, but you don't know. So it's a lot of the mental health, telemental health companies, they did their own research,
For
right?
sure.
So of course they're going to come up with, and I'm not saying that they did anything nefarious, but you do want to make sure that you look at where that data is coming.
There may be some bias. You know, in telepsychiatry, they found that between phone and video, clinically equivalent to face-to-face for mood, PTSD, anxiety, and similar therapy retention rates. But like you said, you have to take it with a little bit of scrutiny, because the one thing is that's all that existed, too. So it's not like you're doing it wasn't neck and neck at the time. And again, mental health during a pandemic is a unique experience.
Yes, absolutely. Yes, I'll leave it at that. Absolutely. And I think that, you know, and there's some research that shows that in intensive treatment, telehealth and in-person both led to similar reductions in depressive symptoms, quality of life gains. But time and time again, research has shown, whether it's in-person or tele, that the therapeutic alliance, the relationship between the therapist and the client, that really is so instrumental. And so you can build that whether you're on telehealth or in person. So I don't think it's like one is better than the other, but I do think that there are ways that telehealth could be more problematic in that sense if if you're not requiring the person maybe to be out of bed. I mean, I've had clients try to do telehealth appointments while in bed with the covers almost completely over their head, cats climbing all over them.
Yeah.
Like that's a very different experience than sitting with someone face to face and being 100% focused on the therapy.
Yeah, normally you don't have to ask someone if they're clothed in person. Which I think I've had to do. Are you wearing clothes? They were not. They were not. They were in bed, no clothes. And I mean, the camera wasn't anything X-rated, but I was like, yeah, you might be a little depressed. So, and I think that they also were hinting on with that too is the intensive treatment, which is intensive outpatient therapy versus just your standard practice of just going to regular outpatient thing. I guess the outcomes there were similar. On the prescribing side, there's one study found 45% average reduction in depressive anxiety symptoms with telepsychiatric care. Again, it's relatively new. I mean, I would say relatively new. Like started off with not a whole lot of data. And then with COVID, again, you have to consider other confounders within there because of pandemic-related anxiety. I mean, something's better than nothing, I will agree. Yeah. But we should probably look at the formats from each of the formats, strengths, pros, cons, etc. So to start, let's start with in-office. That's our traditional method of starting things. So personally, I prefer this for initiating meds for complex cases. If something's simplistic, I don't think you necessarily have to come right in. And I know a lot of people want to meet me in person and then go other routes, but you can pick up a lot more in person, in my opinion, in terms of like nonverbal side effects of medications. Sometimes if people have tremors, they can be hard to see. But in person, there's not that wall there. You don't experience it. You could actually feel another human being is there versus just looking at the technology that you've been staring at. Because most people are phone drones versus in front of a computer all day.
Yeah. And honestly, I mean, I agree. I definitely am partial to in person just because that's kind of what I've always done. But I also feel like it's very interesting because I've moved locations a couple of times. And when people come in, they come for a very long time. You see them for a while, like a couple of years maybe. And it's just, you get so used to that space. It's almost like a sacred space. And so funny because I'll move offices. People will walk into the office, into the new office, and if let's say my chair and the sofa are like switched, and they will just come in and they'll sit in my chair instead of the sofa because if it's like on that side, just because they're so used to just like, this is my space. I come in, I go to the right, I sit down, and we talk, and then they'll sit there. It's not like one person did this, like many people. And then they'll sit in my chair and they'll be like, wait, like, should I be in this chair? I'm like, no, sit on the couch across the thing. But it's like, also I feel like every time I have moved, I feel like it's sad almost to leave that space because I think about like all the stuff that is in that room, like all the experiences and all the the funny moments or all of the really difficult moments, or I don't know, it's just something about creating that space. And you can still create that online. It just is a little bit, obviously it's going to be a little bit different. So I think that the other thing you can do with in person is you have more control over the environment, right? When
Sure.
people they could be in bed, or their dogs are barking, or people are walking in, or sometimes people try to do it from the car. People have done it with like other people in the room, and it's like, I don't mind. I know people are limited sometimes. Maybe they need to go in their car during their lunch break. That's fine. But when people are trying to do it while they're driving, I mean, there's definitely, they're not going to be all in the way they are sometimes in an office.
Yeah, and it's funny because I rent office space now, so I would say about 10% of my practice comes in person. Again, whether that be for the first appointment, or I just have people who just like to get out of the house, and they're like, "Can we do in person?" Sure. And I have spoken to the place that I rent; they are fully furnished offices, but the when you have something that's consistent, it's just, I think their brains appreciate a pattern. So again, even just changing your office space, like they moved me to a different office one time, and they're like, "Oh, here's a different space." I still try to create how my desk looks, because I just travel with a traveling desk basically and my laptop. But yeah, I mean, sometimes it can be just difficult with commuting, or if you need to take time off. There's also a stigma, so you might feel a little more comfortable at home than going into a mental health practitioner's office. And a lot of people almost half of young adults with depression go untreated due to cost, access, or any discomfort with meds. So it's sometimes it might not be the right setting for everyone. I will say that people who were used to going to in-person settings and have to go to telehealth, a vast majority of them do not enjoy it, in my opinion.
Absolutely. So many of my clients switched back to, after COVID, they switched back to, they couldn't wait to get back to in-person. Some people didn't come at all when it was just tele. They just weren't going to do it. They, either they didn't have the privacy, or they just don't like that experience. And, I think that's certainly up to them.
Yeah. So, and let's segue into telehealth. And I just personally, I remember switching to telehealth with my own provider at the time for therapy, and I just felt like she wasn't all there. Like, that she was easily distracted by looking at the things that were going on, where I was, and like things were popping up, mail and stuff was going on. Like, it just felt like a little bit different. I've preferred therapy in person for sure. For medication, I actually prefer telehealth. Frankly, I think it's a little bit, sure, there are going to be some things that you miss, but a lot of people clinically, it works well for ongoing med management. One health system found that telepsychiatry had a 30% higher appointment completion rather than rates in person. It can be very convenient. You're right. Sometimes a little too convenient. I've had people in the car driving that you have to tell them to stop, because clearly that's not safe. People will go shopping. I tell my clients, please treat this as if this were an in-person thing. Keep your clothes on, leave them on, put them on if you have to put them on. But idea being that the respect should be, treat it as if you're in person. I like to set it up such that, the way that I do it is, if I'm doing telehealth, I'll be sitting at a desk and there is nothing else going on to distract me. I have like 2 monitors that I use, and I keep the person, it is hard not to look at yourself, but I keep the person to the left of me, and I like to see what's going on. I will concurrently work and like type in meds and notes and stuff like that, but it's really headphones too. I think headphones actually make me pay more attention than putting someone on speaker.
Okay.
But that's just me. But, the people who love it, and younger people love it. Younger people love it.
I have a client who is much younger, and she, maybe in early 20s, she lives literally 10 minutes from my office. She does not come, she does it all telehealth from her bed. And it's fine. I mean, I love her, but like, because I like to actually meet people and see them, it's very interesting. I'm like, your gym is right across the street. Like, you could come into the office, and, she just prefers tele. That's fine. We're still able to do, good work. But I think sometimes people, like, for me, I feel like telehealth is very helpful in creating better access to people.
And we're talking about video telehealth right now. Like video.
Yes.
We'll get to the phone one. And we'll get to phone only, because I think that's a different animal in and of itself.
Yes, absolutely. Like phone and text, let's put those aside for a second. So right now, just the video, even video, I feel like providing access is important, but I also feel like going to therapy, if you're trying to really change, it is a commitment and it is work. And so we want it to be accessible, but I don't feel like it should be like there's something about driving to therapy, going in, having to do like
You're
that's
putting the
effort.
work in. Yeah,
Exactly.
yeah.
And not that it's not effort to log on and take that time, but I feel like sometimes people can, I mean, so many people will be doing other stuff or they'll be like, I'm sorry. It just, and I think that part of it is being very focused in the moment in therapy on this is your time to do this. And it can get a little bit, I worry about it, the how it's going to be long term, if it's going to be effective because of those things.
Yeah, and I mean, I think for meds it's a little bit different. Like I think, and we've talked about this even just aside from the podcast. Like, I think when people can report symptoms, again, the assessment isn't as good as it is in person. Don't get me wrong. Like again, seeing tremors or seeing someone's gait or looking at their tone, muscle tone, a lot of the appearance type stuff. But really, people who are on antipsychotics, you can see like some of their movements are a little bit different. If they're sitting down, you might not catch them, but a lot of the facial movements you would see and get. You can do that on camera, which is way better than, in my opinion, just the video. Which I said the previous practice I was at, that's all we did was video. So it was pretty interesting. And I had a lot of people who were on antipsychotics there, and I would have to ask them to report them. But anyway, I guess the idea being for me, people can come during their lunch. I like that. It's unless you're geographically close to where your therapy appointment bit, or in my case your medication prescribed. And I think we don't have statistics on it, but I think a lot of people, even just now, like your general PCP, a lot of people are just doing, insurances are encouraging telehealth appointments, making them cheaper, and they're incentivizing them too.
We have clients that have a lower copay for telehealth. Like
Which is weird. And I didn't understand it because my contracted rate is like, regardless, it's the rate. Like don't think most of mine telehealth, I'll have to double check, but I'm pretty sure telehealth for me, it might be coming though. Telehealth for me and in person are the same, but you're right, the copays are usually different. And sometimes you have to get like authorizations, like pre-certs and stuff like that for people to come. But telehealth, I'm not quite sure what the difference is there, but it may be coming that there's a lower reimbursement for it.
Yeah, and I think it's very company dependent, but it's not all things are equal. And some people have stopped covering telehealth, like just certain ones. It's very weird.
Or their telehealth is like, what is the word? Contracted out via only certain providers.
Yes. If you're doing tele, you've got to use their...
Particularly for mental health.
Yeah.
But let's see, what else? I guess we'll piggyback phone. I don't do a lot of phone stuff. You know what I do phone for? If people can't do a thing and I just want to go over labs with them. That's simple.
Like a quick thing.
Yeah, or someone's calling, hey, I have a quick question. It doesn't require me to whatever. Seldom are questions quick, but I think the idea is that like if it's a quick question like, hey, can I reschedule this with you or whatever, most people do email anyway for like a lot of that stuff. But if people don't have time to text, call, or whatever, I don't allow people to text me because there's, even in emails, there's a lot of like, and this will probably probably ties into it. So for the phone, yeah. And you would think too with phone, like people are going to be home, but there's so many people who don't answer the call. The telehealth, I think, is in terms of hierarchy of like most work, it is in person, then it's telehealth video because you have to like semi-look presentable to some degree, one would think. And then like with video, you could definitely be there without clothes on and I wouldn't even know. And that's fine. And go ahead.
With
like
the phone.
The telephone. But video, I would catch you. And like I said, it would be a little scary like it was before. Yeah. And then what are your thoughts on phone? Do you do a lot of phone therapy or no?
To my knowledge, no insurance reimburses a phone session, not to my understanding. So we do every once in a while, and it's only usually because there's like a problem with our link, like the telehealth link or something, or I'll just be like, I'll just call you. Like if we spend too much time trying to figure that out. So every once in a while we will, but it's just a one-off. I personally don't think that the whole therapeutic experience should be conducted with, or can be effective without seeing the person.
Yeah, the reaction and exactly facial cues, 100%.
Everything. I mean, because so much of our communication is nonverbal,
sure.
And there's, if there's a delay in someone answering a question or a response, how do you know it's a a true delay. In person, you'll be able to see that they're looking up, or that they're, they've covered their face, or they, that kind of stuff really matters. And you can't see that on the phone. And so you get so much information for those things. There's a concept that in therapy, it's like incongruent. So if somebody is, I ask them how they're doing, and they say, oh, I'm doing great. But at this time that they're saying that, they're kind of shaking their head no, that they're not actually doing great. But if you just hear them say they're doing great, you're going to assume they're doing great. And so, like, the nuances are extremely important, I feel.
Yeah, I think so too. And I think that, there was an argument that if someone is established that for a regular med fill or a check-in, a phone would be fine. But like I said, it's just not in my practice to do. Does the picture drop sometime? Of course, of course. And then if someone, I will say that if I'm talking to someone and then their stuff drops, I will drop from time to time just to make sure that like we can finish the appointment.
Oh, me too. I will. Yes. Oh, I will absolutely. I will do a phone call over sitting with like a frozen person on the screen. That is too distracting for me.
And because some people walk around and then you have to tell them, please stay still.
Yeah.
It's a whole situation. But I will say, like, and that's the least preferred out of my situation. But
I saw someone once, they were on a telehealth therapy appointment with their, like a family appointment with their children, like with their adult children. And, you could see that person, and then you saw their adult children and therapist, all tele. And the person's boyfriend was off screen, like sitting in the room. And then people were like, wait, is he in here? And she's like, well, he's just in here for a second. And I was like, no. So that kind of, sometimes it can get a little tricky.
Yeah. So I guess the last thing we should talk about is text-based therapy. For medicine, I don't do text at all. The phone service that I use won't allow me to get text. And I like that. I don't want a text. I want a conversation at the bare minimum on phone, because I need to hear you in crisis. Is this like in real time, you need to be accountable with an answer for questions I have, versus like I said, sending things back in email takes forever. Like if it's that important, you have to dedicate the time to, at the minimum, a phone call. And then if it needs to be converted into a video session, that's what we're going to do.
Yes. And I do feel very strongly about text therapy not being a thing. I mean, that isn't that's not, talk therapy was talk therapy for a reason. There isn't, a lot of the, there's a lot of these new big tech companies they're tech companies, but they are saying they're therapy, therapy practices. And so they're allowing a lot of these options for text therapy. And there's just no evidence that text therapy is actually effective, because it's not therapy. Like, you can say it is, but it actually isn't. So if someone were to say, if I were to call you if I was to tell you, hey, I can't come in tomorrow, I feel like, or I'll reschedule next week, right? If I say that, I can say that 10 different ways, and it means 10 different things, right?
Sure.
I can't come in tomorrow. I can say, I can't come in tomorrow, right? I can't come in tomorrow but we'll figure it out next week. But we'll figure it out next week. Look, the intonation
tone,
matters.
inflection,
Exactly.
Delivery. If you're hushed because now you're in a situation where you could be in danger, and whoever it is doesn't want you to come in, and you sound very different than what you're not going to get that from a text. Again, sometimes even email, it's hard to pick up on cues with that, but if something's quick and whatever. But
there's certainly a place for communicating like that, but not
as the standard.
Exactly. And not as the other problem with a lot of the text therapy plans and the offerings is that they aren't in real time, right? Like, they're not just like, here's your hour of session. It's like, you can text your therapist as many times as you want in the day, and the therapist has to text you back once or twice. I mean, that is nuts, because if you're texting your therapist all day and just venting about things, and your therapist now has to sift through tons of texts that they don't really, they don't get to hear exactly what, your inflection, like you said, and what they're doing. And then you just have to reply a couple of times. I mean, the whole thing is like, it's just not a modality that came out of research.
Well, we're not trained on it either, right? I mean,
it's not a real thing.
Yeah.
We're not trained on it. They made it up so that they can offer it. That's why insurance companies, at least they haven't. They maybe the lobby's going to get really strong and they're going to start, but they don't cover text therapy because it's not.
It's all out of pocket.
Text, absolutely, because it's not evidence based. It's
gotcha. Yeah, the research largely excludes text only care.
Exactly, because it's not real thing. It's not a thing. I gotta get off my soapbox for it.
I mean, I don't know enough to know that they do it. I don't think they'd be able to do it for meds, because there's so much you have to ask, like the back and forth. Like I know that my intake is very detailed, but I still have to go over that because sometimes people don't understand the questions. They answer it very like wrong. Like that's not what I was saying with that, or the question, you didn't answer the question directly, which is what I'm looking for. So like even reviewing that, and that would probably be a text-based modality more or less, but that's me then via video conference going over it, or I almost like pre-screen with it where, hey, you didn't fill this out, I need this information. I'll go back before I say, hey, let's set up your first appointment. But that's like very different than completely deciding upon a medication or even a therapy modality to I
don't. I mean, that's gonna be
there. Maybe, and I mean, well, let's talk about the benefits of all of them, and then maybe we can kind of, if there is a silver lining, pull it out. So for in office, for me, it's good for new meds, for complex cases, for people who like in person, for people who need structure. And again, eliminating that gives a more personalized human touch to care, I believe.
And you think about like people, they don't want, if you, let's say you have social anxiety, certainly telehealth is going to be easier for that, but it's also not challenging you at all.
Yeah, growth comes from challenge, does it not? It really just, and when you commit to that, it shows that you want to work towards being better. The physical presence there, we talked about full nonverbal cues, body language, gait, a number of different things, muscle tone, those sort of things.
Or even if somebody comes in your office and they didn't take a shower, right?
Like, you want that. Yeah, I mean, sometimes that's a blessing, but I guess you want to be able to document that.
For tele, you mean?
Yeah. If someone, well, yeah, if they didn't shower, I'd encourage them to do that. But for televideo, this again, it can be useful for, again, like I said, a bunch of my people will come in person at first. We'll get to meet one another. We built that rapport, in-person rapport, and now if they're stable, and it's also beneficial for people who are rural. I see a lot of people who live very far away and have no other choice.
That's the best part of telehealth.
That is. It really is. It kind of bridges that gap. But if you're someone who lives close enough. Also, too, I have limited availability. I only do in person 1 day a week, so that might not meet their schedules. It's convenient. There still is a visual connection. Again, some of the cons of that are really like, if your internet connection sucks, isn't it painful? It is like the most painful thing in the world and I understand that not everyone can afford the best internet, or sometimes there's like if there's a surge of use, it just slows things down. But I've had people who are like echoing the whole time and I'm like, can we please do this on the telephone? They're like, no, I can't. I have to do it like this. And it was just like an hour appointment for me took like an hour and 45, and just immensely painful. I've told them if it happened, I said, listen, we got through this, but you either need to do that or you need to figure something else, or we do it at a different time when you can get better service. Don't do it in the supermarket. Again, sometimes people are limited as to the times that they have. Like, I've had people go in the supermarket and then be like, hold on, I'll get somewhere quiet. And that's perfectly fine by me. Because, and on your a bud or whatever. So phone, some of these things I think are a little they're a benefit for sure. Those with camera anxiety, who are socially anxious. If someone is very socially anxious, I can get that, but like you said, it does take them out of their shells. Multitasking schedules, I really think kind of therapy and medication management, if your schedule is so super busy that you can't find time somewhere to do it, okay, it can happen, but that's not the best way to manage someone's mental health. And there's tons of different ways. I also encourage people who are on the East Coast who have jobs that are 9 to 5s and they can't find anyone. California's 3 hours off. Get a telehealth over there.
That's a really good point. Because I'm sure there's people that are licensed in New Jersey.
1,000%.
In California. That's a great point.
If you look on where we advertise, it's so interesting to see, because I know I advertise in 3 different states, but, 2. But I am licensed in 3 states. But I guess the idea is you see people that are in so many different areas that do have the mix of in-person versus telehealth, but the in-person is in a certain area. The telehealth can be in like 4 different states or however many. But so, yeah, I think there's an accessibility thing there. But, in terms of phone, if that's your jam, great. But I think for us, we take insurance and a lot of insurances are not covering it. So, again, in a private practice, you would have to kind of negotiate an out-of-pocket expense for that. And then text.
It's just not.
Text is not for medication management. The benefits here, and just kind of to discuss them, would be flexible support for people who are anxious or neurodivergent individuals. Written processing, so sometimes people who have auditory processing issues, perhaps there could be a reflection time and just asynchronous help. There's not a lot of data that supports it, as you said. It can also, it's not paid for by insurances as of yet, but who knows where that'll go. So
I feel like the text therapy is offered through these giant companies that really started as they're a company and they figured out how can we get in on this space, because mental health has just blown up, in the last 10 or 15 years.
It also makes you wonder too, like, are they going to have AI giving text-based therapy?
Oh, that's on the horizon. Oh, that is 100%. Yes. And I think they have to inform people if that's going to happen, but we could do that in another episode.
I guess I wonder. Yes. I mean, I think that, like, what if these text-based people, you can't tell me they don't have cheat sheets that are already pre-populated, and what if that was AI prepared? Is that something that is, I don't know. I mean, I think it's, even with my EMR, they have like things that AI can help you rate your notes. It makes me a little scared. Mm-hmm. And I just don't know if that's, I mean, if it's a double-edged sword, it can certainly help you think, but is it always appropriate? Not exactly sure.
I mean, there's not everything that helps in therapy is what you say. So there's times when people will be talking, like, there's the therapeutic use of silence. That is very important. There are times when we will be silent on purpose, and that will lead the person to come, or the client to come up with something or elaborate on something, or then be like, I can't believe I just said that, or I just answered my own question, or whatever. And that is not existing in text. You can still pull it off on video.
Yeah, and even too, like, for people some people, therapeutic touch is big for them, where they just like that, like, will you hold my hand while I tell this story? You can't do that in some of those modalities. No. So I guess it depends on you. Again, kind of the hierarchy, in my opinion, would be in office offers you the most range of things. Might not be appropriate for everyone's schedules or geography, but it gives you the broadest range of assessment and a delivery of your mental health care.
And I would argue that it really does give you the best. You can certainly get to know somebody on video. I do think that, but I think in person is going to give you the best view. I mean, if a client walks in and they're carrying 3 bags and stuff's falling out and whatever, I mean, you're not going to get to see it. And likewise for me, like, once I forgot my shoes, and so they get to see who they're dealing with here. Why did you forget your shoes? You're a therapist. So I think it's like, you build a different kind of bond.
Sure.
I think.
Sure. And, video, obviously the more opportunity there because you can see more things. Phone, it's still a method in which to deliver. Just again, in terms of reimbursement, I don't think we're going to get it. And that, although some people prefer to pay out-of-pocket expense, I think that there can be things there. Again, you're just going to miss some of the nuance there. And then text, we just aren't advocating for necessarily at the moment.
And I would say that if you are going to do telehealth, there are tons of big companies, right? There's tons of big national places that you can go to. You see the ads 1,000 times a day. I would say find your local practice, because every local practice also does telehealth. I mean, I don't know of anyone that says we will not see a client telehealth. Like, everybody has come to that now.
So they had to with COVID. So I mean, a vast majority, unless they're newer practices that just don't want to do it. During your credentialing process, well, if you take insurances, you're asked, do you want to do telehealth?
Yes. I mean, I can't. Most people will do that modality as well. So what I would say is, first, call your local practices. Do it that way, and then ask for a telehealth appointment. And then that way, even if so licensure goes by state, right? So if you're calling one of these national companies, they are only going to hook you up with providers in your state. That they have to. So, but that, if they work for them exclusively and they're exclusively telehealth, they don't have an office. You're never meeting this person face to face. I know for our practice, we have an office. So I could see somebody telehealth for 2 years that lives 3 hours away. But if they one day want to travel down here and come visit me, which I've had that happen, they'll come in and they can have a session in person. And so I like that idea that they know we have a real office. And not to say that you have to have an office to be a therapist, but I think there is something about, having that in-person option if you really needed it. And even if you never see them in person, just having a local practice that is, I don't know. And of course I'm biased, biased, but I do think that there's a benefit.
Yeah. I mean, I think that a lot of prescribers, a lot of medication prescribers, a lot of them where it's the rarity to have an in-person place these days. Because that's just, and maybe even for therapy as well.
Oh, absolutely.
But again, with that, one of the things that people generally ask is it okay if you switch? So I've had people who were coming in person and they're like, this is really not working with my schedule. Can I switch to telehealth? Love it. And then there are people who that can only get certain medications if you're seen every so often. So they're like, let me do telehealth and then I'll do my check-in, for stimulants or one of them. So for ADHD, you have to be seen per your state regulations. The COVID waivers, ending in December, that's going to the FDA is kind of, who knows where it's going to go, but you need to be like, I have that option for my patients. So I or clients, I love to have that fluidity such that if I need to see them more frequently, again, like I said, I rent, but I could go up in my, how many times I see people a week by my package. But I wanted to have that opportunity to have that space where people could go if they wanted to.
If they wanted to, right.
Yeah.
And that's why it is okay to switch formats whenever you want. You just have to make sure your provider is able to do that, because it's
Sure.
like you said, if you have a telehealth provider and they don't have an office and they work exclusively you're not going to be able to switch to in person.
Yeah. And then I think it's also like, I'm sure you've had this happen before. Oh my gosh, I got stuck at the office. I can't make it there in a half hour. Can we do a tele? Wonderful.
I have no problem with people switching to tele. I'm here anyway. Like, it doesn't, if they want to switch to tele, I'm perfectly fine with that. I will say, as a therapist, and especially as a therapist with ADHD, I definitely prefer in person, because I'm still held accountable with tele, because I don't use headphones. I keep the screen right in front of me, one laptop in front of me in my office, so that way I'm still just as present. But I do find it, it is easier to get a little more distracted when I'm on tele. I try not to, but
Yeah. I agree, because there's things that fly up. You can I think some of them even now have a do not disturb function where you can just be in the whatever, so nothing's popping up. Because I do think it takes away a little bit of how genuine your attention span is when that's why I like to wear the headphones, because if there is a noise in the background of the computer, my client's not going to be able to hear it. I also, that's part of my ADHD, is if I have headphones on, they lock me in. And I'm like, okay, I might be distracted by looking at myself every 3 seconds, but you can even turn that off to yourself. So I just think I'm vain. But anyway, I think that there are telehealth and in-person care are effective for a variety of different mental health diagnoses, and sometimes nuanced care is based upon what the client's preference is. I know a lot of people who don't want to leave the house. Again, that's a double-edged sword where you have the security, but now you don't have the challenge of facing that fear, because you can do anything at home right now. You can shop, you can do all of your appointments. If you need blood work, they can come to your house. A number of things can happen, but further care and advancing your own psychological growth may be stunted because of those limitations.
I mean, and really the bottom line is that you are engaged in therapy and that you stay consistent. So if one of the formats helps you do that more than the other, then we're all for that.
Something is better than nothing by far.
Absolutely. Well, some of the formats are better. Not a bad therapist isn't better than no therapy.
Yes. Oh, that's true. In terms of formats, yeah, for sure. So I think that's wrapping it up. Again, if anyone has any questions, any experiences, I think that's what we need to open it up to. I mean, if someone wants to share any experiences that they had in mental health, we could probably do that one day, where it's good, bad, whatever, weird,
We would love to, yes.
Yeah,
we already hear there's so much with our clients, right? All their stories, their experiences of therapy. But if you guys have any, we would love to hear them.
Yeah, and you can either write it, or I think, if you voice, again, we can utilize all of our methods here. You could tell us in person if you want. You could tell us via video, you could tell us via audio, or text it to us. No, don't text us. We don't take text. But we would take emails.
Yes,
so
email, yes.
That would be pretty neat to hear anything, in terms of your mental health experiences, or even if you wanted to share that game changers. Telehealth was a game changer for a lot of people for mental health. I know that there's not exactly a drastic increase in people seeing providers, but those who might not have gone before, that may have just been a bit of a nudge, not having to get out of the house and be like, all right, I'm going to start this, I'm going to try it. So at least it's an avenue, another opportunity for people to get access to care that didn't have before, or felt that stigma, or just felt like they weren't able to make the leap and went for it.
So, I'm Katie.
And I'm Dominic, and this is the Long Story Longer podcast. Make sure you meet your mental health appointments either via in-person, telehealth, video, phone, or text.
And definitely wearing clothes.
Goodbye.
Bye.